started in surgery and was very excited to be a surgical oncologist, and took a little break to on what we can do to address and end the childhood chronic disease crisis, highlighting 4 main categories of problems, but looking at the food that we eat. And that was a new number from the CDC just in August. Looking at lack of physical activity and chronic stress and screen time.
So we mentioned that, and of course we get all the states to try to pass legislation to stop that. What are you planning to do for that? I mean, we're really interested because that's our bill this year.
Yeah, no, it's a big question. We're working very closely with Alex and his team on what that looks like. Again, I think there needs to be a lot of education in the country generally on high THC, and marijuana, recreational and medical, all is high THC now. And then you have very highly concentrated products that are widely available and unregulated. And so the FDA is already starting to take enforcement from, you're asking what we can do from here. FDA is figuring out what enforcement capabilities it has. And there's a lot of open questions on this and work that we're doing on this.
Sustainably, so we really advocate for ways that we can, we're in preventative care, so I'm sure you've heard this. Women don't always have access to it, and doctors and nurses aren't trained in it, and so we want to make those available for them.
Yeah, we spent a lot of time on this topic over the summer as well. I think we put quite a bit of detail in that document. And there was a question of, should we talk about infertility as a strategy for children? And our view was, yes, absolutely, because a lot of these patterns of unhealthy habits are starting, especially in adolescence. When young girls are on birth control, often don't understand all of the context and aren't always well informed. So it was very intentional to put that in there and to have HHS. You should know Dr. what we think is a reproductive endocrinologist. She's the acting assistant secretary for health, and this has been her #1 issue, to make sure that the root causes of chronic disease and root causes of infertility are front and center, and that the solutions that HHS is working towards is focused on that pre-fertility part. And we've certainly met with a lot of the restorative reproductive medicine doctors and are excited about what they've developed and the long history and getting that more socialized and more available in the healthcare system.
Could you share how we get access to that report?
Yes, the criminal liability questions from that law. So, what we published yesterday is a commitment to a vaccine framework that is making sure that we have the best childhood schedule. Directly to change the law, but there is, I think, what we have been directed to do is to look at, and you saw some of the growth of our schedule versus other countries, things that are required here or recommended here that are optional in other countries, making sure that
in Europe, they're very careful about anything about GMOs. We have bioengineered foods, we have hydrogenated fats. Are those things that are going to be listed as well?
all of that, yes, that was all kind of covered yesterday. So, and you've already seen a lot of transparency now from the FDA. And so starting with just chemical transparency tools, things